Lateral epicondylitis. Now this is a very common condition. We may know it better as tennis elbow. Before we talked a little bit about cubital tunnel, which is on the medial side of the elbow, your medial epicondyle, where your ulnar nerve is. And if you recall, I talked about how the flexor muscles of the hand, the pronator muscles of the hand actually attach to your medial elbow. So if we go now to the other side of the elbow, where your lateral epicondyle is, that's where your extensor muscles of your forearm attach, and your supinator muscles, so wrist extension, finger extensors, all of those muscles attach to the lateral epicondyle. And this is where this disease process takes place. Just want to quickly distinguish it from medial epicondylitis. All these terms get very confusing. Sometimes that's also called golfer's elbow. This is different than cubital tunnel because there's not necessarily associated nerve pathology associated with medial epicondylitis. It's more of an inflammatory condition. But this is much less common than lateral epicondylitis. So the extensor muscles most commonly implicated are extensor carpi radialis brevis and the common extensor belly, which is extensor digitorum communis. All of these attach on the medial epicondyle, and it's an overuse syndrome. So anybody that has a lot of repetitive motion in their forearm or their wrist, they can aggravate this area, and you get these micro tears along here. And then it's kind of a cycle where you have a lot of inflammation and then periods of rest followed by further aggravation of the micro tears, because nobody really wants to rest long enough to ever let them heal. And then you get intense pain in that area. There is another condition on the differential diagnosis, which is a very lesser form of, common form of nerve compression, radial tunnel syndrome, which is a little bit down there. And the pain from that condition is more down here. Not any necessary nerve pathology is associated with this condition. It's actually very, very common. Thought maybe 1% of all Americans might have this at some point, which is, I think, a very generous estimate, but it's extremely common. It makes sense that it most commonly happens in the dominant arm. It's very common in manual laborers or anybody who does repetitive motion with tools, with forearm and wrist extension, anybody that has to operate heavy machinery frequently with a lot of turning and twisting of their wrist. And men and women are equally affected. So if you think of why it's called tennis elbow, up to 50% of all tennis players develop this condition. And if I started playing tennis, I'd probably definitely get this condition because it has to do a lot with your technique and proper training. And a lot of times, I'm sure all the occupational therapists know this, but just simple modification of how one plays or how one holds their racket could lead to dramatic improvements in one's symptoms. So again, we talked about why this happens. You get micro tears in the fascia, and the tendon itself, or in the muscle itself. And they have done studies which show that there's increased hypertrophy in the collagen of that area, and there's disorganized collagen as well as a lot of inflammation and vascular hyperplasia. So it's definitely something different, than say a healthy tendon and muscle. So what do patients actually complain about when they come with this? They complain of pain in that elbow with use. Sometimes pain at rest too, but certainly exacerbated whenever they want to do certain activities, either playing sports or simply opening a doorknob. That certainly would aggravate it. Sometimes decreased grip strength, because sometimes just the act of turning and twisting open jars or doors will require a grip as well as contraction of your muscles. So when these patients come in the office, some of the hallmarks of physical exam are point tenderness at the lateral epicondyle. This is a very sensitive and specific exam for this condition. And there's about 3 other things I do. I usually shake their hand, and then I do resisted supination of their wrist. That tends to aggravate this condition. They have intense pain at that area. And also just what you see in the picture here, they have a resisted wrist extension. That also